and the continuation of infectious medicine. Today our topic is syphilis. So what is syphilis? Syphilis is sexually transmitted disease which is caused by a bacteria. So what is that bacteria? That is called as troponema pallidum. So troponema pallidum, it is gram negative spiral bacteria, right? So troponema pallidum is a gram-negative spiral bacteria, and it is a slender spirochete. It is a slender spirochete, a fine spiral with a pointed end. So that is spirally, and the ends are pointed. So that is troponema pallidum. Now, how the disease is transmitted? So let's discuss the mode of transmission. So most commonly the syphilis, it is transmitted by sexual route, by vagina, anal canal, and orally that comes in contact with lesion. Also it is transmitted by direct contact. It is transmitted by a blood transfusion, and it is transmitted through transplacental route, while the most commonly it is transmitted by sexual route. So what is the pathophysiology of syphilis? So whenever there is injury to the skin, so what happens? So whenever there is injury to skin, or we can say or there is abrasion and skin or mucosa, so what happens that after abrasion, this troponema pallidum, it enters into body via abrasion, and it rapidly spread, and the blood or lymphatics, and ultimately this troponema pallidum, it bind with the vessels. This troponema pallidum, it bind to endothelial cells. Soon as when it bind to endothelial cells, it cause the inflammation of vessel, and that is called as end arthritis. It lead to end arthritis. End arthritis means that there is inflammation of the vessel, and it affects those vessels which supply the nerves. So ultimately the nerves couldn't get the proper blood supply, so the nerves get destroyed. So because of disruption of nerve, there is which sort of lesion occur? Painless lesion occur. So in syphilis there is painless lesion. So how? That's how it causes the infection. I repeat. So whenever there is injury to the skin or there is abrasion, so troponema pallidum enters into the body through that abrasion, and then it's spread in the blood or lymphatics and bind to the endothelial cells and cause the inflammation of vessel in the form of end arthritis. Now let's talk about clinical features. So there are different stages for the syphilis. So there are the first stage is, that is primary syphilis. There is secondary syphilis. The third is, there is latent syphilis, and there is tertiary syphilis. So we will talk about each type of syphilis in detail. Now if I talk about primary syphilis, so in primary syphilis there is hard chancre. There is hard chancre. Now what is basically chancre? Chancre is raised papule. Chancre is raised papule, and it is most commonly seen on the penis, cervix, anal opening, and it is seen in rectum. So what are the most common sites for the canker? The most common sites are this: penis, cervix, anal opening, and that is rectum. It identifies the type of sexual activity. So the chankar, it is the basically painless, it is painless ulcer with indurated borders that spontaneously resolve within 2 to 6 weeks without any scarring. So what is basically chankar? Chankar is the painless ulcer with indurated borders that spontaneously resolve within 2 to 6 weeks without any scarring. So what is the difference between the nodule and chankar? So if I talk about nodule, so in the nodule, that is the centrally nodule is thin but peripherally nodule is thick. While in another hand, if I talk about chankar, and chankar, the centrally it is thick but peripherally it is thin. So that's how you can differentiate the chankar from nodule. Secondary syphilis developed 2 months after the healing of primary lesion. Now in secondary syphilis, there are polymorphic rashes. There are polymorphic rashes, and these rashes, they are typically seen on palms and soles. They are seen in the palms and soles. And there is condylomata lata. Condylomata lata, that is nothing but that is the painless warty lesion. And why painless? Because the vessel that supply the nerves are damaged. So and here that is painless watery lesion. Also there is patchy alopecia. So these are the three important features for the secondary syphilis, that is polymorphic rashes, condylomata lata, and there is patchy alopecia. Now if I talk about the latent syphilis, so in the latent syphilis there are no symptoms but the patient is seropositive. So in latent syphilis there are no symptoms but patient is seropositive. It means that the patient has a disease but patient is not clinically manifested. So it is further divided into two subcategories, that is known as early latent syphilis and late latent syphilis. Now what is the difference between early and late? In early latent syphilis, the patient is seropositive within the 2 years of infection, while in late latent syphilis, the patient is still seropositive but after 2 years of infection, right? So it's important. Now if I talk about tertiary syphilis, so tertiary syphilis it developed after decades of the acute infection, and usually there is a formula of 15 into 10 into 10. It means in 15% cases there is formation of gamma in case of tertiary syphilis, right? In 15% cases there will be formation of gamma, in 10% cases there will be CVS effects, cardiovascular effects, and in 10% cases there will be neurosyphilis. Now what is basically gamma? Gamma is nothing but it is a granulomatous lesion with necrotic centers, and keep in mind that this gamma, it is most pronounced on which organ? It is most pronounced on two organs, that is bones and that is skin. So gamma formation, it is always pronounced in the bones and in the skin. Now in the CVS effects there will be aortic aneurysm. There will be aortic aneurysm, and there might be aortic rigor as well. So aortic aneurysm, that is because of vasculitis. And vasculitis and arteries, it lead to blockage in the form of shock as well. So there might be aortic aneurysm, aortic rigor as well. Now if I talk about neurosyphilis, and neurosyphilis, what happens that there is inversion of CNS agar, there is inversion of brain. So ultimately the patient may manifest it with you with a meningitis, and there might be presented with the tabes dorsalis. What is tabes dorsalis? Tabes dorsalis is basically demyelination of dorsal column, and they might be presented with the Argyle-Robertson pupil. Argyle-Robertson pupil mean that the accommodation reflex is intact, but the pupillary reflex is not intact. Accommodation of the patient is normal, but the patient is not reactant to light. In case of Argyle-Robertson syphilis. So congenital syphilis, it is mainly seen in the intrauterine transmission during delivery, and this congenital syphilis, it consists of the special triad. And what is that triad? That triad consists of, yes, sensorineural hearing loss, and there is interstitial keratitis, right? There is interstitial keratitis. And what is the next clinical feature? That is dental abnormalities. So in the dental abnormalities, there is might be Hutchison teeth, right? So there might be Hutchison teeth, and there might be mulberry tongue, there might be mulberry molar. Mulberry molar means that there is a poorly defect in the first molar. There might be saddle nose, and there may be saber shin. What is saber shin? This is the anterior bowing of the tibia. What are the investigation options in case of syphilis? So first of all, we should do the dark field microscopy. So dark field microscopy, it is done for which type of syphilis? Yes, that is seen in primary syphilis. So the dark field microscope, it is done for the primary syphilis. And the dark field microscope, what we see the bacteria, we see the tropenema pallidum. Screening tests are basically non-troponemal test, and confirmatory tests are called as troponemal test. These are troponemal. So basically the non-troponemal test, it is used for the secondary syphilis and tertiary syphilis, right? So what are the screening tests? Screening tests are RPR, that is rapid plasma reagent test, and there is VDRL test, that is Venereal Disease Research Laboratory. So that is considered as a screening test for syphilis, while the confirmatory test FTA ABS test, that is fluorescent troponemal antibody observed test. So that is considered as a confirmatory test, and that is troponemal test. Now for the neurosyphilis, in case of neurosyphilis, if the patient is presented with neurosyphilis and that condition, what we can do, we have to perform the lumbar puncture, and then we need to send it to the serology. So the lumbar puncture should be done in case of neurosyphilis. It looks like a dangerous disease, rather it is a dangerous disease, but the treatment option is very simple. For the treatment, we can give penicillin. So penicillin is the drug of choice in case of syphilis. So that is penicillin. Now if the patient is presented, if there is primary syphilis, or if there is secondary syphilis, or if there is early latent syphilis, so in all these conditions, we need to give the single IM dose of benzathine penicillin, right? If a patient is allergic to penicillin, then you can give the doxycycline or ceftriaxone. So if we talk about the late late latent syphilis, or if there is tertiary syphilis, if there is tertiary syphilis, which data of transmission is unknown. So in that condition, what we need to do, in that condition we have to give IM benzathine penicillin G weekly for 3 weeks, right? If the patient, if now in case of neurosyphilis, what we need to give? In case of neurosyphilis, we have to give IV penicillin G for 10 to 14 days. So I repeat, if there is primary syphilis, secondary syphilis, or early latent syphilis, so in that condition you have to give the single IM dose of benzathine penicillin. But if the patient is presented with the latent syphilis or tertiary syphilis in which the date of transmission is unknown, in that condition you have to give IM benzathine penicillin G weekly for 3 weeks. And if a patient is presented with the neurosyphilis, then in that condition we have to give IV penicillin G. What is Jarisch Herxheimer reaction? Actually, the phenomena that is seen after 24 hours of treatment of penicillin G, that is called as Jarisch reaction. So in this reaction, the patient is presented with fever, chills, and hypotension. And the treatment option NSAID, meptazinol, which is opioid. So student, that's all about the syphilis.